Hi guys, my name is Archana Raman and I'm a clinical occupational therapist for children and adults, and today I'm going to talk to you about tips that you can use to help fussy feeders. And as I'm talking to you about this, I'm also going to include reasons why we are going to do these things, because I'm hoping that when I give reasons out, parents will feel more motivated to carry through with the therapy, and also they know why they're doing what they're doing. So fussy feeders in the first place are those children that have a food repertoire of under 20 foods. It could be in any format: pureed, hard munchables, solids, and so on. And when you introduce new foods to them, they will avoid it. They may have reactions like gagging or grimacing when they see food, or they may develop extreme anxiety. And today we're going to target this advice for under 5 years of age. So my first tip would be is introduce your child to as much messy play as possible. So messy play is where you get the child to play with different textures like mud, water play, sand play. You could play with grass. You could get the child to play with food as well, and allow the child to become as messy as possible with food. Now the reason being, a lot of children have extreme reactions to sensations in their hands and feet through the sensation of touching. So what will happen is, even me, I don't like messy textures around my face or my hands. I don't like any food that's a bit lumpy. So it could be oats porridge, it could be anything that's a bit lumpy. I prefer things that are more dry. So when there is these children react a lot to these textures, they develop aversions, they develop hyper extreme sensitivities towards these textures. This doesn't just stay with the skin on their hands or this part or their body, and for some children it's on the feet. It doesn't just stay there. These textures, these textural aversions, and these tactile sensitivities also go to the oral motor cavity, the cavity inside the mouth. So we may offer children certain fruits and vegetables, certain meat varieties, and the children might just refuse them. For example, there are children who don't like the texture of banana, tofu, meat, or even it could be even snacks that are a bit, that have ridges on them. And the minute they look at them and you offer it to them, they might just say no to it, or they would just turn their face away. And as parents, as most parents who come to me, they say, oh, my child doesn't like the food. But this goes beyond liking the food. This goes to the point where they have these extreme sensory reaction from a touch perspective to all these things. So when you allow these child to play with messy food textures or even messy play items, their body is going to send these friendly signals to the brain saying, okay, now I'm becoming friends with these different textures, so I feel a bit safe to explore. I'm now friends with these new textures, some which are rough, some which are slimy, some which are soft, some which are chewy, some which are a bit crunchy. And then the child will slowly start allowing you to even bring it near their mouth. And then the child will then integrate all this information and process it even in their oral cavities. So I'll give you one example of how you can play with textures. I'll do a separate video on this. So you could start with dry foods, rice, lentils, pastas, pulses, noodles, and things like that. And if it's a boy, you could take the child's dump truck, put some rice on it, and move the truck across on the table or even the feeding surface and say, oh, look, the truck is dumping some rice. The truck is dumping some sand, and the sand is actually the rice granules. And then slowly you can move on to wet textures like cooked rice, boiled pasta, and boiled noodles and vegetables and so on. So you just have to get a bit creative with that. The second thing is, don't give big portion sizes to children who are fussy eaters. So keep the portion sizes small and give the meals more frequently. This is because when the entire family and different caregivers give different portion sizes, the child's brain tends to get confused. And secondly, children who are fussy eaters do not meet their calorific intake for their day and their nutritional needs. So what then happens is these children have growth issues at times, and they don't meet their growth charts. So height weight ratio or body weight ratio and so on. So what you need to do is give small child sized portions, but at more frequent intervals. So this is just an example. You could give them breakfast at 9, and then another meal at 12, another meal at 5, and interspace it with 2 small snacks between the 9 and 12 o'clock and between the 12 and 5 o'clock. And then a high calorie drink at night. Now consult your local dietitian for further information. Another thing is, don't give them 3 meals, but give them 5 small meals. 3 big meals and 2 small meals in the day. The reason is that when you split the meals into 5 again, you can meet their calorie and their nutritional intake. And also, children who are fussy eaters develop this anxiety when you show them new foods or even certain foods that they don't like, and they may not show it explicitly on their face. They may just do it grimace, or they may, if you show them food, they may just go back from the table a bit, or they may do that hand, they may stretch out their hands, which is called a hands play, or just turn their head away from the food, just slightly, ever so slightly, that you don't even pick it up. So when this anxiety builds up, then the appetite for food goes down, and we don't want to lead it to this stage. So when you give them small size portions and split it across the day, I don't mean binge eating throughout the day. So this is a mistake a lot of parents do. They give food every 1 hour or half hour. Don't do that at all. Space out the food and keep the times at set meal times is what I'm suggesting. When you do something like this, it's going to reduce their anxiety towards new foods, anxiety towards foods that they don't like, and so on. The next tip is have family meals. Now most countries are right now in a lockdown, and it's a beautiful time to sit down and have family meals with the family. Of course, many of us are working on our computers from home, so we may not be able to sit with the child and have a meal. But let me tell you the benefit of having a family meal. Children learn by seeing more than by listening to advice when it comes to most things, and even feeding. So you might have noticed that your child who's a fussy eater tends to put a particular food in their mouth and just one bite and swallow it, or there are children who out of fear just put it in their mouth and swallow the whole lump. And many of us give children mashed food, mashed dal rice, khichdi, and things that are chopped very finely to these fussy eaters, because they're not eating properly and chewing and swallowing foods properly. So when you get them into a family meal scenario, they see most adults sitting with a nice posture, sitting upright, and posture has a huge impact on eating, you guys, and I will put a separate video on it. I can't insist on how important posture is for feeding. So when you sit as a family, they'll look at the posture of everyone else, and then their brains will be like, okay, this is how we are also we also have to sit up and eat. And they will also learn things like you might keep giving routine advice or regular advice saying, look, you've not chewed your vegetable, excuse me, you have to chew it this way. But that doesn't get into their brains as much as them sitting together in a family. They sit down and observe everyone else chewing that same meal that's in their plate to others, and they will learn that this is how we are meant to chew. Of course, there are other problems like underlying conditions like oral motor problems, or jaw issues, or poor strength in this area, or lack of tongue movements, which will also contribute to poor chewing. But at least they get to see, if they don't have these other problems, they'll get to see that, okay, this is how I'm supposed to chew my food and eat it. Okay, the next thing is, when you cook a meal for a fussy eater, make sure it's not a separate meal that caters just to their needs, unless they have medical conditions like reflux, where they can't have certain foods, or they have a diagnosed condition. Make sure whatever you cook is what they can have. Of course, this doesn't apply to babies who are still breastfeeding. Whatever you cook as a main meal should be on their plate as well, and it takes a lot of exposure of the same food for the child to learn that, okay, now I'll get used to this food. The food has to be on their plate. I hear a lot of complaints from parents where in the house the mom has to cook one meal for child number 1, another meal for child number 2, and another meal for the family. And how much burden is that on the person who's cooking? So I hope you enjoy these tips, guys. And we offer feeding consultations for children who are neurotypical, and for neuroatypical children with medical diagnoses like autism spectrum disorder, ADHD, Down syndrome, cerebral palsy, and so on. And one important thing of why you should target fussy eating before the age of 5 is that research shows that when you allow children to be fussy eaters after the age of 5, this habit and pattern sets in their brain. It's very difficult to break it, and they also become very prone to childhood chronic conditions like diabetes, obesity, and therefore cardiac issues. So I hope that you will be able to implement these, and let us know how it went for you if you have implemented these in the comment section below. And if you like this video and appreciate it, give us a like and a subscribe, and press the bell notification below. Good luck, guys. Bye bye.